Hey guys, how are you? I wanted to start going live over in this group so that you were able to connect a little bit more and just to give you some information and answer questions and things that have come up in the comments each week. So I figured I would go live just starting off this way. I um, probably will pick like a standard day and time that I'll go live in the group so that it's like pretty consistent, or I don't know, I might just go off the cuff whenever I have something to say. But you can always watch the replay. So, and of course, if you have any questions, just like comment and I can answer them in a future video, or I'll respond into the comments as well. But I'm really excited to be able to connect with you guys on a more personal level and hopefully be able to give you some really good tips and solutions for what to do about hip impingement and labral tears and all of that. So what I thought we could chat a little bit about first today was I had asked that question on Monday, I think, about what are some of the common symptoms that you have. And I thought it was a good opportunity to just review some of what people said and give some insight into it. I think, one of the earliest things that I teach my clients is to start to track the symptoms. So, and hopefully that kind of made you really sit down and think about like, well, when do I really have pain? I notice a lot of times with my clients that they'll say, oh, I have pain with XYZ, but when they actually start tracking it, they realize that it's maybe not what they thought it was, or sometimes it's the opposite where they feel like their pain has zero rhyme or reason. Like it feels very random, that there's no pattern to it. And when we start tracking it, you very quickly notice, oh, wait, there is a pattern. And sometimes it takes a physical therapist or somebody to be able to pull that pattern out. Like, oh, well, so every time you flex your hip, it seems like it brings on pain, right? Like to you, it's just, it hurts when I sit sometimes and when I put my shoes on or go up and down stairs. And to me, I hear anytime I flex my knee towards my chest, flex my hip, it brings on pain. So the symptoms that you might think are not important are usually really important and relevant. And I promise you, there's a pattern there. You just have to figure out what the pattern is and know how to decode it a little bit. And if you don't know how yourself, like this is when you seek out help. This is what I'm here for. So I think step one is just making sure that you can track your symptoms. I actually do have like a PDF of a hip symptom tracker. So if you're not sure what types of things you should be tracking or how to track it, I'm happy to give you guys the download for that. So just maybe comment on the video tracker and I can make sure to send you over a copy of that because I think that would probably be really helpful for a lot of you guys to just track it. But even if you don't want to do it that way, if it's too much to print it or even do it on PDF on your computer, just put a note in your phone. Open a note. You can see kind of what the things are that I tell people to track, and then you can create a note in your phone and just fill it out that way. But all that information is really helpful, especially if you're already working with a doctor or physical therapist, to be able to pull that note open and tell them like, oh, hey, this is what I'm feeling and when I'm feeling it is huge, especially because a lot of times you sit down in that room and I'm like, okay, tell me when your hip hurts. And people sort of go blank, like they can't remember over the course of the past week what's happened. And that's okay. You shouldn't have to, but if you do a really quick, 1 minute journal entry, so to speak, in your phone or on a piece of paper or whatever, it's an easy way to track it and then be able to share that with your healthcare provider. So some of the things I pulled up, some of the things that people said brought on their pain. So after sitting for a while, standing up, like when you move from sit to stand, but especially after sitting for long periods of time, like taking those first few steps. I'd say this is a really common one. Sitting in general can be really aggravating for people with hip impingement. And I think that that's often confusing of like, why does it hurt when I sit? I'm not doing anything. A lot of it has to do with the position that your hip is in. You're in a little bit more of like a posterior pelvic tilt, which is like, sorry, my phone's ringing. Probably should have silenced it. A posterior pelvic tilt, which is kind of where like your tailbone tucks under and like your back rounds a little bit. And what that does is it puts a little bit more anterior pressure into the hip joint. If you guys have watched any of my like webinars or anything, I talk about this a lot, how my hip impingement people tend to be my chronic butt tuckers or butt clenchers because it pulls you into that posterior pelvic tilt. So when you do things like sit for extended periods of time or recline back on a soft couch or, big comfy chair, driving in that like sort of bucket seat, those positions can often aggravate the symptoms a lot because it puts a little bit more pressure into the front of the hip joint. So then when you go to stand up, the hip almost is like stiffened a little bit into that position, and then it's very uncomfortable because it has to kind of glide back into the joint. And I say that with caution because I don't want to give the impression that like your hip joint is like gliding a ton. It's very, very minimal movement. But what happens is like just the muscle imbalance creates more pressure either on the front or the back side of the joint. And so when you're sitting kind of in that posterior tilt, there's a bit more pressure on the front, and then you have to like rebalance it as you stand up. The other thing that happens when you're sitting for long periods of time is your hip flexors stiffen right up. Hip flexors get a bad rep as far as like they always feel tight. People feel like they need to stretch them all the time. And while that is often the case where there's some stiffness and tightness there, they're not always short. And there's a difference there, which we can maybe talk about in a future video. But they become very stiff and restricted in that position, so that when you go to stand up, they don't really want to lengthen back out. And it takes a little bit of time to get the blood flow back to them and get them to lengthen again. So that's also why sometimes it takes a few steps to sort of warm everything up so that things are actually flowing again and gliding and moving the way that they should. So I say that's a fairly common one. It can be helped by trying to move more frequently. So trying to, if you sit for work, trying to set a timer for like every 20 minutes or so, where you even just stand up sometimes and like move around, go to the bathroom, get a drink of water, something like that. It doesn't need to be a long period of time, but standing up every 20 minutes, having a sit or stand desk. You don't want to stay in any one position for too long, so you vary between the positions. I think that's also kind of an important thing to note, is that no one posture is bad for you. It's just the length of time you spend in a posture that's not great. So sitting for work, we can't avoid it, right? But maybe we can alter between sitting and standing. And if you don't have a standing desk, could you put your laptop at a counter or something like that? Or can you just get up and walk frequently? Sitting on the couch, I wouldn't tell you to not sit on the couch. Please go relax, but maybe don't spend too much time in that position, or find a position that's more comfortable while you're on the couch. So just a few, little tips there. Another common one was sleeping. So sleeping, I will say, is a bit tricky because you can't control it, right? You can control maybe how you fall asleep, and you can find generally a position of comfort getting to sleep, but then in the middle of the night, being able to control what's happening is not always possible. Sometimes you just end up where you end up. Now, if you're tossing and turning and it's keeping you awake, then you might have a little bit more control over it. But if it's happening in your sleep, then, I think for a lot of people, what I tell them is focus on the things during the daytime, because the daytime is generally what's creating the inflammation that's aggravating things that make it hurt at night. So if you can focus on what you're doing in the daytime to get the inflammation down, sleeping and nighttime will get better. So generally with my patients, we focus more on what they can control during the daytime hours to make sleeping a bit more tolerable and comfortable. There's also things you can do, like maybe doing your exercises right before you go to sleep at night, so that, the timing of them matters. If you are waking up with pain in the middle of the night, see what happens if you can do your pain relieving exercises right before you go to sleep. Maybe you're fine during the middle of the night, but you wake up in the morning and you're feeling really stiff and restricted because, again, you've spent a long time in that position without moving. Maybe doing your exercises first thing in the morning might be the solution for you. So changing around the timing of exercises around sleep can be really helpful. And there certainly are some positions that can be more pain relieving, which again, maybe we can, talk about in a future post. But I usually recommend just focusing on the daytime stuff first, and the nighttime will follow. I feel like those were like the two most common ones that I saw. And certainly just know that like there is no right or wrong in this. Your symptoms are your symptoms. And so I will tell you, for the most part, there's a pattern that I see. I've been treating hip impingement for 13 plus years at this point. And so there is sort of some common patterns that we see with impingement, but that doesn't mean that everybody must fall into that category. So you're not weird for feeling the things that you feel. You're probably not an outlier. There's probably somebody else who's experiencing something very, very similar to you. people always say to me when they come in, they're like, this is going to sound weird, but, and I'm like, no, it's not going to sound weird. I promise. I've probably already heard it. Because your symptoms are your experience. And so don't ever be afraid to share what those are, because even if you're not sure if they're related, they probably in some rhyme or reason are. And even if they're not, right? Like, it's really important for your healthcare provider to know that. So don't ever feel like ashamed of what your symptoms are or nervous about telling somebody, because you're not weird. It's your experience, and there's no right or wrong. Like, there's not this specific box that you have to fit into with symptoms. So hip impingement is sort of this umbrella category of something that's happening mechanically in the hip, but it doesn't mean that symptoms all fall into that specific box. So hopefully that gives you guys a little bit of insight. Again, if you want to get the hip symptom tracker, just leave a comment that says tracker, and I will get that over to you guys. I'll probably email it over to you. And please let me know any questions that you have, anything like that. At any point, leave a comment in our Facebook group, because that's where I'm going to try to hopefully get the content that I'll be going live on and answering questions that way. So please feel free to share and connect with one another. And I'm really excited to start connecting with you guys. Hope you all have a good rest of your day.